Hi, I'm Sam. I'm a nurse in primary care within the UK, and I'm hopping online today just to have a quick chat about diabetes and chronic kidney disease. When we see our patients for their annual health check, we're looking at their overall health and not just at their diabetes. So, for your annual check, we'll have you come in to surgery and we'll discuss how you feel your diabetes is managed. We'll talk about medications that you're currently on. We'll do your blood pressure, your height, weight. We'll do a foot check. We'll take some bloods and that all important badgering for the urine sample. Having diabetes can increase your risk for microvascular complications and conditions such as neuropathy, retinopathy, and what we'll be focusing upon today, nephropathy. Your kidneys are important organs. Blood is filtered and cleaned through them, and they take away excess water and end products from medications and food and use these to produce urine. They produce hormones and chemicals that our bodies need to produce red blood cells and keep our bones healthy. They play an important part in controlling our blood pressure too. But this is why high blood pressure can be both a cause of damage and an effect of damage to those kidneys. Over time, high blood glucose levels can damage the small blood vessels, and high blood pressure can damage the structure of the kidneys. If they do get damaged, they become less effective at removing those waste products and excess water from the blood, and also in producing those hormones and chemicals that our bodies need. During your annual review, we take bloods and they'll look at your HbA1c level, your renal function, liver function, and your cholesterol level. And your renal function test is where we're able to see how well your kidneys are working with how much blood they're able to filter in 1 minute. Your urine sample that we badger you about is also important, as we can use this and have a look and see if there's protein in it, which we normally shouldn't be able to see in urine. But if we do see, that can be the first sign of that kidney damage. There are some simple things that you can do yourself at home to protect your kidneys, such as eating healthily and watching the amount of salt that you eat, losing weight if you need to, staying active, and stopping smoking. Then, using the results from your annual check and your blood tests, you can work with your nurse and discuss things like your blood pressure. If you have diabetes and some kidney damage, then we would aim for a blood pressure of 130/80 or lower. We'd check on your cholesterol levels and we'd aim for those to be total cholesterol less than 4 and LDL cholesterol less than 2. If yours isn't, it's not a big thing. We can talk about it and we'd look at starting something maybe like an atorvastatin in order to bring that cholesterol into those healthy ranges. And we'd also obviously make sure that your HbA1c is within an acceptable level for you as a patient and as an individual. If kidney damage is found, but it's mild, on the whole, your care will remain within primary care. We'll see you yearly and carry out those all-important checks to make sure that the function isn't declining. If you have symptoms of kidney disease, then we'd look at treating these, for example, correcting anemia if we find it, or maybe starting on medications to help with fluid retention. Later stages of chronic kidney disease could mean that we need to discuss further intervention. Maybe that's conservative management, maybe dialysis, or potential for kidney transplant. But all of these things will depend on your personal circumstances. And I can't stress how important it is for you to go to your annual health review in order to try and nip things in the bud before they become too big a problem and cause you other issues alongside your diabetes.